We're going to go ahead and let world-renowned Fred Metzger,
that's what I told them. That's what I told you.
He's going to be our next seminar. So Fred.
All right, hi everybody. Welcome John Koritko, the man, the legend. Big hand for him. Hey Johnny. How's it going? If this is your first trip here for my talk, I do this almost every year. I hope I don't bore you with the same stuff if you've been here before. But I'm a veterinarian, so I'm here to give free advice, man. This is it. I said, all right, this is your chance. Because I'm not cheap, am I, John?
No, he's cost me an arm and a leg.
That's right. So,
breakfast for a whole year. Big surgery every day, 5 days a week.
We definitely got to meet Angel, because there's one of our patients.
Yeah, it's more than a year and a half now.
Wow, really?
Yes, yeah, I would expect
That's fine. That's really good. How old is she now? 13. Holy crap. I didn't plant him in the crowd. That's a real patient. Yeah.
I have to tell you. Okay. Like 3 or 4 years ago when you were here talking, you told about a serious injury and putting sugar on it.
Yeah. Did you have one he used it on?
I put a whole bag inside her.
His question, if you want to know what he was saying, is a couple of years ago I was giving a talk and I talked about on wounds. One thing that I like that's cheap and it works great is sugar. Granulated sugar, right out of the bag, not sterilized, Domino sugar. We use it all the time on wounds. Like you get a cut that won't heal, you get a wound, a hot spot, or an abscess, it works great.
It was a glass cut and it cut her whole gut bag.
Yeah.
And it was late at night, and so we're like, hey,
you might as well try sugar.
We laid her on the bed.
Yeah.
The whole bag of sugar in the wound. Next morning, got her to the bed.
Yep.
And she said, this looks like it just happened.
Right.
And she goes, when did it happen? I said, like 9 hours ago. She goes, no way.
Yeah. That's going to be a younger vet who's never heard of sugar, I guarantee. The sugar, the thing with sugar that surprises people, sugar draws the fluid out and the bacteria actually can't grow in it because of what's called osmotic pressure. It's too much, it's too concentrated. So it's actually antibacterial and actually draws the fluid out. You can use honey as well, but I like sugar a lot better. We use it on a lot of abscesses. In fact, I had a dog years ago. I've been a vet 32 years, so I'm talking like my first year or two. And we had a bear that attacked a dog and literally just ripped all the quadriceps off this poor dog. It was a Labrador. And I told the guy, like, we're gonna have to amputate the leg. I mean, you could see the bone and the nerve. You can see the sciatic nerve. Like, there's nothing else to do. He's like, I'm gonna just put the dog down. Because we can't hunt. I said, well, he's like, is there anything else we could do? So of course, what did I do? I talked about doing the sugar. And this was like a 2-month process. I mean, this was a huge wound. Because sometimes you can't close things or they're infected. You don't want to close an abscess or it gets worse. And that's where we use the sugar. So good comment right out of the back. Practical stuff. One thing I like to do is just kind of give a general overview of some new things in vet med that I think would benefit you, especially if you own the hunting breeds, the sporting breeds, which almost all of us do. And then the other thing is we'll just do questions. So a couple things, I talk about this every year, fleas, ticks, because we have to. I mean, everybody here that has a hunting dog already knows how bad the ticks are. It used to be fleas were really bad, now it's ticks. So here's what you want to know on ticks. One is, we can usually see them, but it's going to take 24 to 48 hours for a tick to transfer one of the infectious diseases to your dog. Everybody knows about Lyme. That's not even the one I'm worried about anymore, because everybody knows about it. Almost everybody gets the Lyme vaccine. You have to get the Lyme vaccine. Is it optional? No, you got to get Lyme vaccine.
We have it at Lyme.
It's terrible here. It's a 2-shot deal. You have to have it. It's too prevalent, and I don't care if you're from New York or New Jersey. Pennsylvania's #1. That's not even the one I'm worried about. The bigger one that you need to worry about, and you got to worry about. Yeah, thanks. You got to worry about U2, which is epidemic in central Pennsylvania, is anaplasmosis. It's a tick-borne disease, gets in dogs and people. We see everything before the MDs do, so we've known about it for the last 5 years. So Anaplasma is a bacteria that's transmitted by the same tick that transmits Lyme. So that's why we see it all the time around here. The big one I look for Anaplasma, it's much more of an acute disease than Lyme disease, meaning it hits them harder and faster. Lyme, they get infected, a couple months goes by, they start to limp. Some of them get other problems, you know, neurologic disease. It's a slower disease. Anaplasma, they get a tick that has anaplasma and infects them. Within a week, they got a fever. They're lethargic. They look like they're going to die. They have blood clotting problems. We've seen it now for years. I have a specialist in my practice called Holly Brown. She's a board certified clinical pathologist. There's like 250 of them in the US. She moved here because her husband's Justin Brown, who's the Pennsylvania wildlife vet. We have one wildlife vet, it's him. In fact, yesterday we put a transmitter in a freaking muskrat. They're studying muskrats. Why, I don't know, but that's what they're doing. So, you know, I talked to Justin a lot about wildlife diseases and what they're seeing. Back to his wife, Holly, who's the pathologist. We started seeing about 4 years ago dogs that came in very ill, lethargic, febrile, meaning they have a fever, platelets very low, which are part of your blood clotting. We run the IDEX 4DX test, which is a great test that almost every vet runs. It's a great test for Lyme and other tick-borne diseases. The problem with that test is, and a lot of veterinarians don't know this, that's why I'm telling you, a lot of times dogs will be negative on the 4DX test. So the 4DX test for heartworm, Lyme, Anaplasma, and Ehrlichia. So you would think if you'd run the blood test and your dog had one of those, it would be positive, right? They're antibody tests, so it takes at least 2 to 3 weeks for your body to develop antibodies. So if your dog got infected with a tick that had Anaplasma and it was only a week or two, they'd be negative on the test that it hadn't been long enough to get antibodies. So we started seeing this disease, and the way we diagnose it is we look for in the white blood cells, there's 2 purple dots we look for. My point is this, if you don't look for it and you just ran the 4DX test, the veterinarian misses the whole disease. So when I'm talking to vets, I'm telling them, if you're in Pennsylvania or Mid-Atlantic, you got to be on the lookout for Anaplasma.
What is the test you got to ask him for now, Fred?
They got to be looking at the blood under the microscope.
Oh, so it isn't like another...
You can do a fancier test called a PCR test. It's called polymerase chain reaction, same one they run on people. We can run that for Anaplasma. But what normally happens is we get dogs that are real lethargic, their platelets are low, we're going to suspect a tick-borne disease like Lyme, Anaplasma, or Ehrlichia, and we're going to put them on doxy, right? I have no problem with that. The other, so that was anaplasmosis. They're seeing it in people a lot. Like hunters would be #1 for anaplasmosis. The other, back to Lyme, which we all know about. The problem with Lyme disease, for me, it's overdiagnosed. So what do I mean by that? You take your normal healthy dog into the vet, we run the 4DX test, which is heartworm, Lyme, Ehrlichia, Anaplasma. We tell you your dog is positive on Lyme disease. I guarantee everyone in this crowd has that. And then what you walk away thinking is that your dog has Lyme disease, and that's really not the case in a lot of dogs. It means your dog's been exposed to Lyme disease. They may have it and they may not ever develop any problems with it. So my point of that is, if I have a dog that's limping and really sick or has kidney disease and they're positive on the Lyme test, which we call the 4DX test, then I'm much more inclined to think they have Lyme. We know a lot of dogs are running around that have antibodies to Lyme and they're never going to have a problem with it.
If your dog's on Lyme vaccine, what's the percentage that if it's on it,
yeah,
that, you know, is it 80%?
Great question, Johnny. It's even higher than that. It's a really good vaccine. It's probably over 90%. The thing is, if you don't do the Lyme vaccine and your dog gets Lyme, one thing we see a lot in the retrievers, if you have a retriever, Lyme nephritis, which is kidney failure from Lyme, that's almost always fatal. It's a special form of Lyme that gets in the kidneys, especially in the retrievers. Goldens, Labs, you know, any retrievers, that's your #1 nightmare, and we see it. And once they get it, it's really bad. So you want to avoid that by doing the vaccine. And I'll tell you about what tick products in a second. Yeah.
Do you have to request the Lyme vaccine?
Yeah. If you're a vet in Pennsylvania, I would hope they're telling you. But here's what I found: a lot of people don't. It makes no sense at all to me. The other one you have to get in a hunting dog is leptospirosis. Leptospirosis is a bacterial infection in dogs and people. You and I can get it. They usually get it from drinking contaminated, like water puddles that have urine from infected animals. Like wild animals, a lot of them shed leptospirosis. Your dog drinks it, they get infected. If you're not infected, or if you're not vaccinated, your dog gets lepto. And when your dog has lepto, they go into kidney failure, and when they're urinating, they're spreading the organism. You could get it. Like when we have a leptospirosis suspect in our hospital, we wear gloves, we have a big sign. It's a big deal. You do not want it. Just vaccinate.
Isn't lepto part of the 5-way?
Yes, but not all of them. Make sure you're getting lepto.
So if you're given even a 5-way shot, which is the small 5-way, 7-way, 10-way shots we sell.
Yeah.
You know, so even the 5-way has lepto in.
I would read though and make sure. I'm not worried about your vaccine. I'm worried about like what the vet's giving you. Like make sure that hey, I got an outside dog. You need. I would hope vets would say this. Here's what I've learned over 32 years. They don't. It's like people get busy or they're not familiar with hunting dogs, and I feel that way about any dog that goes outside. I think you ought to vaccinate an inside dog for Lyme too. That's how bad it is. On ticks, I'll show you what I like. Johnny, I took some products from your shelf.
Whose shelf? Mine or yours?
Yours, they're mine now. So here's on ticks. I make it real. You have all kinds of cool tick removers. I think you need like an engineering degree to run some of them. This is what I use. It looks like a spork from Kentucky Fried Chicken. It's just a stupid little spoon with a V slide. This is what I use. And you just slide it under the tick and you just push it forward, and it almost always pops them right out. I mean, they're inexpensive, really good price, by the way, John. You gotta have these. I mean, this is what I use. If you get a tick out within 24 hours, they're probably not gonna transmit the disease. So I like that. Open the catalog, look in your store, go to your vet. There's so many products, it's really confusing, I think, on flea and tick. So what are my favorites? My favorite, there you go, would be that one. Shoot the dog.
Shoot him.
Shoot him. Just shoot the tick. I love Bravecto. Bravecto is the 3-month chewable. I love Bravecto. It's good on all the ticks, 3 months. But if you have a hunting dog, I personally would use that and something else. I like Bravecto. On my own dog, I use Bravecto and then Vectra. This is the topical, the monthly topical. There's Frontline, there's Advantix. They're all okay, but I think we're getting some resistance. I personally don't think they work that well anymore. This is probably my favorite monthly. Vectra, John, you have this. This is your product.
Vectra's not fipronil?
No, it's not fipronil. That's why fipronil's Frontline, and they're just kind of wimpy anymore. That's why I don't think they work really well.
Right about that.
Yeah, it just doesn't work. Here's the one thing on this. If you have a cat, like an indoor cat, you want to make sure you don't ever get this on a cat, unless you want to get rid of them. Cats, you put this on the night before. I tell people if you have cats, put this on the night before, make sure your cat's not rubbing against your dog, and then you're okay the next day. This stuff's not, cats can't metabolize this. This is a topical that only goes on the fur. The other one I definitely love is Seresto.
Yeah.
And your price on this is ridiculous, which is good. So I would go buy one. I really do like the Seresto collars, either by themselves or I like them with Bravecto. If you want to really make sure you're whacking everything, I use them together. Yes.
If you allow your dog to stay in bed with you at night, is it best to take that off?
That's a great question. I personally, that's why I like the chewable. That's why I like Bravecto. It's ingested, done. I always worry about collars, and especially children.
Fred, don't you think though, people will say to me, I'm not giving my dog something like Bravecto that it's going inside of
Yep.
it, and who knows what it's going to cause years
Yeah.
down the road.
Yeah.
How do they know that?
Yeah, we know what it causes, and it causes nothing, just by the mechanism of action. Bravecto is sold by Merck, kind of a big company. I mean, they've studied this for a long time. It's called Fluralander. It's a whole different class of drugs that have absolutely no effect on mammals. Like they fed dogs 70 of these for a week without any I mean, there just are no side effects. These ones, there's no side effects, but I do worry about people, because when you read the instructions on anything topical, it's going to tell you don't handle them. I personally don't think it's going to do anything, but especially if you have kids or grandkids, I do worry about that. But I think if you're looking for one product long term, and this is probably the one that most people talk favorably about, and I would agree with that, is this one. I don't think there's anything wrong with doing the Brevecto with this if you want to double whammy. In my own dog, I do Brevecto and then I do this once a month over the really bad, you know, from March till December. Anymore though, just like with heartworm, ticks and heartworms are year-round in Pennsylvania anymore. Do not stop them. Everybody wants to, don't. You're gonna get something, I'm telling you. Heartworm, your dog has to be on heartworm preventative. Not even so much that we have a lot of heartworm, but it's a once a month wormer. There's a lot of good. I like Interceptor. That's, you know, that's a good chewable, but you know, HeartGuard's great. There's injectable ones now. There's an injectable 1 year one called ProHeart. We had ProHeart in the US about 15 years ago. It was a 6-month shot. It was really nice because you come in, give a shot, you're done. Then it went off the market. Now it's back ProHeart 12. My personal opinion is I worry a little bit about giving one shot that lasts a year. That freaks me out. And you got a chewable pill your dog likes. I would just do that. And it also gets hookworms, roundworms, and whipworms. And tapeworms. That's Interceptor.
Is it like ivermectin in that plus something else?
Interceptor is salamectin. It's a different, if you look at HeartGuard, that's ivermectin. I like Interceptor over HeartGuard because it's a little more broad spectrum. It gets whipworms.
My friend Marty Smith, like Foster's and Smith, he swears, he tells people just use a horseworm.
Yeah, I mean,
ivermectin, give them
that's insanity.
Shot up.
That's just insanity.
And the big time trainers will do that. You know,
here's one thing. Here's what I would say. If you've ever seen ivermectin toxicity, especially in the collie breeds, it's a big problem. They get neurologic disease for about a week and a lot of them die. Why do that? They're not
it's a horse warmer.
The stuff's not that expensive. Get the dog product that's weighed out for their weight and give it to them, be done with it.
But for those it's not toxic to, doesn't ivermectin have a relatively safe zone?
Yeah, it does, but the problem is with ivermectin. So like that's good. Like the wildlife vets, Justin, that's what we use too. The thing I don't like about ivermectin is it's not very good on whipworms. So like I don't like HeartGuard. If you read the back of a HeartGuard, there's no claim for whipworms. Whipworms are a bit of a problem. That's where I like the Interceptor a little bit better. Make sure you're worming them every year too. If you're on a good monthly heartworm preventive, you're not going to need to worm your dog because you're worming them every month. So you know what? Life's too complicated. Do a monthly heartworm preventative year-round. Do a flea and tick year-round. Make sure you're vaccinated, especially for Lyme and lepto and rabies, obviously. We have some rabies around here for sure. That's a little bit scary. The other one I would consider now, if you've been reading, some of the people are saying there's a new kennel cough strain. I never like that term. Kennel cough are all the respiratory bugs. So that could be Bordetella, which there's a vaccine for. I would get that. But then there's a lot of other ones. The big one I worry about is influenza. Dogs get influenza like we do. They get a different strain. You know how people, the strain changes every year?
Yeah, they don't make canine flu shots?
They do make canine flu shots. And what happened was the old canine flu shot was the strain H3N8, which is an older one. The newer one is H3N2. So what we did now is, depending on which one you use, you can buy them separate or combined. I like if you're going to have a dog that's traveling around, I'm going to do both. Do both so you don't have to worry about it. It's a very safe vaccine. It works very well. Because if they get influenza, especially in a younger dog or an older dog, it's a real nightmare. And some of them die.
H3N8 and H3N2.
Yep, H3N8, H3N2, those are the ones that are out right now. That's the influenza vaccine. Yep. Yes.
So if your dog, you get the
40X?
test, your dog test positive for Lyme.
Yeah.
Prescribed dog.
Yep.
Then they get the Lyme vaccine. Is that
Great question. So the question is, that let's say your dog's positive, and we see this all the time, your dog's positive on 40X and not vaccinated. What do? One thing great about the 40X test, once again, is the test by IDEXX Laboratories. I consult with them, it's a great test. But it does heartworm, Lyme, Anaplasma, and Ehrlichia. It's really a 6DX, but we call it a 40X. If you're positive on Lyme, what we would really prefer to do on a dog that's positive on Lyme is run another test called a C6 Peptide Test. We take a little bit more blood, we send it to an outside lab, and they'll do what's called a C6 Peptide Test. It gives a number, which is very helpful. So dogs that are measure over 30, we usually elect to treat them with Doxy. Less than 30, we don't. So if I get like 150, I'm gonna treat that dog. Let's say the problem with that test is like $100. So a lot of people are like, I don't want to spend another $100. Is there anything wrong with doing the doxycycline? No, you don't really, Doxy's pretty cheap, but you don't really know what's gonna happen down the line. Now back to your question, would I vaccinate a dog that's positive for Lyme that's not vaccinated? I would. Some people wouldn't, I would. Here's the only reason why some people don't like to do it. They're afraid if you give a vaccine, you can get antibodies and get some immune reaction. We've vaccinated dogs for the last 8 years that were positive and haven't seen anything. The one thing I love about the IDEXX 40X test is if you would think if you vaccinated a dog, they'd become positive on the test.
Right.
They don't, because it's it's called a C6 peptide. So dogs that are vaccinated will not show positive on the test, which is huge.
So what if your dog has been vaccinated and then tested positive?
Yeah, if that was my dog, I would do the C6 peptide test and get a number.
Is that called the titer test too? Or?
Yeah. Okay. Yep. There's a lot of different Lyme tests that have been out. The best one's really the 40X and then what's called the C6 peptide. It's a specific part of the Lyme bacteria that they're testing for. The other last one I'm going to show, one thing that I think is really kind of interesting, John will laugh here in a minute, on pain management. So, a lot of animals get orthopedic problems. All right, and then I'm going to do question. The big rage that's in vet med that's going to become even bigger is what, John?
What's the number?
Pot. CBD, baby.
Fred's new company.
So I'll just tell you a quick little story. So about 1.5 years ago, I had these people, it's a long story. I got a friend and he says, hey, we're gonna invest in CBD. I'm like, what is that? Pot. And I'm like, well, I'm not into any of that stuff. I mean, for dogs, okay? So they came down actually to State College. They brought a researcher from Cornell Vet School. This guy's double board certified vet from Cornell. His name is Joe Wachschlag. He's an expert in sports medicine and dogs and nutrition. So he told me that they were doing a study with CBD in dogs, and that's going to completely change what we're doing in vet med. So that was about 1.5 years ago. And I'm like, what? I'd like to see studies, because what was happening, everybody's like, this is great, where are the studies? So Cornell just finished a huge study about 3 months ago, and now they're doing 2 more. So here's what I'm going to tell you. So the problem is, we don't use marijuana in dogs, because the THC, which is what gets you high, dogs don't need it. It has no benefit to a dog, and we don't need a high Labrador that's going to eat more than they already are anyway. So we don't want THC. We want CBD, which are the cannabinoids. That's the anti-inflammatory part. So the whole other problem that happened is like, what's the legality? And vets were like, a lot of people were asking us about this. So after the Cornell study, what we found is, and I talked to the researchers, a bunch of at the Cornell Vet School, pretty good vet school, and we tried it I probably started it in July of last year. First person I put it on, Jen Wasson, who's my tech, who's been with me since day one. I got 64 people working at the animal hospital. She was number 1. She had a dog, Sammy. She was ready to put Sammy down. I said, Jen, Sammy's like 14, nothing. Rimadyl, nothing. Tramadol, nothing, not working. I said, let me get some of this stuff. It was in an oil at that point. You'd have to squirt it in the mouth. That dog's still alive. So I used it on a bunch of end-stage dogs where I told people, just try it. I don't know if it's gonna, and I'm gonna say 90% of those dogs had dramatic improvement. So let's fast forward, like where are we at right now? We've seen dramatic effects. The problem with it is It's not very well controlled. There's a lot of different companies selling it, and that's the problem. So the company I like, this is the one that did the Cornell study. It's called Elevet. It's the only one that anybody did any studies on. So if you're gonna give a medicine, first of all, you gotta make sure it gets in their bloodstream. So what we found on Elevet in the dogs, it's got a twice-a-day dosing. It's a chew or an oil. I tell people don't buy it directly from them. Don't buy it from me directly, buy it from them. You'll save about 10 bucks. What dogs am I using it on? Dogs with pain. We're doing a study right now with the University of Florida on dogs post-op knee surgery. Like dogs that are getting TPLO surgery, which is a pretty big surgery, using it for pain management. We're also doing a seizure study right now, and we're also gonna do a behavior study in dogs. And also, we're doing a cat study. You know the cats that are peeing in your house? There's a cat product. Yeah, John's like, no. So what I'm saying, I think the CBD is the real deal. I had my dog on it. I think it's going to change pain management. I think it's going to get rid of a lot of the non-steroidals, like the Rimadyls and the Duragesics and Tramadol, which is a drug that's a human drug we've been using in vet med. We finished studies on that. Now we know it's an absolute worthless drug in the dog. We've used it for 5 years, like thousands of tablets of Tramadol. Doesn't work.
Ultram.
Doesn't work. Ultram doesn't work. So, you know, my thing is use the one. You know, we know the Elevet gets in the therapeutic range, and you can buy the oil directly too. There's people that are taking it. I don't know if anybody here's taking it. Yeah, what have you seen?
Dramatic change, but then I really have nobody to consult with on it.
Really?
And I don't think I'm taking enough of it. I'm trying to find that person
Yeah,
to go.
and the physicians don't know about it.
Yeah.
I mean, we know more about it than they do.
My doctor told me to take it.
Yeah.
Because I don't sleep.
Yeah. One thing that they just released, the FDA just cleared it for kids with epilepsy. So that opened up, now it's going to be reclassified, which is what's happening right now in vet med. Because the FDA, once they approve it in a person, they gotta remove it from a Schedule 1 drug. Schedule 1 drug is like really controlled and the DEA flips out. So they're gonna open it back up. That's why I tell people in this, like if you're interested, just get it from their website. Elevet Sciences, it's called Elevet.
I used it on my dog, Deuce. I'm lucky too, who was blind for 2.5 years and still hunted. There's that video on YouTube of him pointing and retrieving quills blind. Amazing dog and a happy dog. And but then near the end, he just started going down and getting weak and near the end, I think things were just breaking down on him. And so just to help, I got some of that Elevet, and it seemed to perk him up a little bit. Not a huge amount, but at least I felt good that I was giving him something to kind of make the old boy who had bumped into everything and still wagged his tail, something to make him feel a little better.
What we were doing with any new drug, we use it on the worst cases, right? So we don't know about it. We're putting the ones like you're putting it down anyway. Let's try it.
They eat
and
the chewable. They eat it.
I think we're going to use it for long-term arthritis. That's what I think we're going to use it for acute pain and long-term. Because the studies that we've done, we haven't seen any side effects, which I like. Because we did a lot of blood studies on it, like it's going to do kidney or liver. And that's the problem with the non-steroidals. Like even Rimadyl, which is carprofen, or aspirin, man, that freaks me out anymore.
Isn't Rimadyl like the standard by which all vets for
I think it's going to change. The thing is, I do like it, but you got to run blood work and make sure you're not getting any troubles with it.
For after how long a use?
I say even 2 weeks.
2 weeks?
And then I would do it every 6 months. And that includes aspirin. God, make sure you don't use Tylenol or ibuprofen in dogs. Not good.
Tylenol or aspirin?
Really bad in dogs. Yes, sir.
When it comes to pain, should I start early with that?
Yes.
Before the inflammation?
Yes. The earlier you start, the better.
Okay.
And what they do is they use a higher loading dose for the first 2 weeks, then you decrease the dose by half.
And it's either a injection or a
It's a soft chew or an oil. You can buy it as an oil, which most dogs are. I mean, I'm just going to do a chew.
I put it on their treats.
Nice thing is having it formulated. This goes back to like what's formulated for dogs.
Yeah.
It's nice, like that's because what we've learned is all the cannabinoids are different. One plant makes different cannabinoids than another. So one is you have to know what's your source, what's the variability, because this is a plant, it grows, right? So like this one has variability of 8%. The other, they studied 8 products. Out of the other 8 products, only 2 of them had any CBD in them. It's like, people will sell you anything you want. So you want to make sure it's tested and someone has done the testing on. That's the only one they've done tested on, Elevet. I don't know about the other ones, so I wouldn't use the other ones until they've done the testing. What questions you guys, we'll wrap it up with your questions. Yeah.
Itchy dog. I've got a yellow lab, 2 years old, and she's with scratches.
Yeah. So, you know, when I have itchy dogs, I'm always going to go to the more common stuff first, which you've already are going to think of. You know, fleas, and, you know, you're already probably addressed that, I'm sure. So when I hear young dogs like that, you want to make sure you don't have mange, which we don't really see very much of that anymore, but you want to rule that stuff out. Then we get into the more common stuff, which are going to be like the atopic dermatitis dogs. Those are the dogs, just like people have eczema. Atopic dermatitis is where dogs inhale a pollen, or they get it on their feet and ingest it, which sets up an allergic reaction in their skin. Usually it's dogs like 6 months to 3 months or 3 years of age. That's when it usually starts. Usually licking feet, rubbing face, rubbing ears. There's some really cool news. Hey, Randy. There's some new stuff. So what did we do in the old days? We had an atopic dermatitis. What's nice is if you can allergy test them, where we draw some blood, find out what they're allergic to. The problem with that is it's about 70% effective and you spend about $500. So most people are like, not really into that. The other big one that you want to rule out is food allergy. Food allergy is very common in dogs and it can be to anything. So food allergy, the problem with food allergy, it takes several months to see and several months to get away. So let's say your dog's on Pro Plan chicken and rice. As a vet, I'm going to say to you, hey, your dog can be food allergic. I'm going to give you special food, feed it for 8 weeks, and then if we're still itchy, I mean, you're not going to do that. You're going to be like, make my dog quit itching. So what I'm trying to say is the big categories, and then I'll tell you what I would do, are going to be the atopic dermatitis, the dogs that are allergic to things they're inhaling. So it's going to be weeds in the spring, or it's going to be trees in the spring, weeds in the fall. So like right now, ragweed's going to come out, you're going to have a huge spike. If it's year-round allergies, then I'm thinking more food allergies. If it's more seasonal, I'm going to go more with the atopic because of the plants, okay? Treating. So it's nice to know what you're treating. So I just said you could do allergy testing. It's a little bit frustrating because it's expensive, but that's always something you can do. And then you can give your dog shots to desensitize it. And in the days, that's what we would tell you to do. And you guys would look at me like I'm crazy, like you're all doing right now. Or you can change the food for 8 weeks. Buy some real expensive food, try it for 8 weeks. You're not going to do that either. So what we're down to is treating it symptomatically. So what do we used to do? Steroids.
Yeah.
Depomedrol, Temerol-P, Pred. It works great. Dogs drinking, peeing, eating, not fun. So the newer stuff, which is so much better, one's called Apoquel. It's a tablet you give. It's not a steroid. They don't drink and pee, and there's really no side effects to it. It's a great medication. It's called Apoquel by Zoetis. I love it.
What kind of drug is it? What family?
It's called an NK inhibitor. It blocks the inflammatory cascade. Okay. The better one I like more, though, is another one that Zoetis came out with that's called Cytopoint. It's an injection. It's a sub-Q injection that we give. It blocks the inflammatory it's not a steroid. I've had huge luck with that in a dog like yours.
I asked my vet about that, and he said it's $100 a month.
I don't know what he's charging. That seems a little heavy, but you know, Cytopoint for how much is your dog weigh? Yeah, that would seem a little high. I would want to check that, but I love that because I'm usually getting 4 to 8 weeks out of one of those shots, and it has no side effects. It's a monoclonal antibody. It uses your dog's immune reaction to block it, so there's no side effects, no drinking, no peeing. And by the time you do the Apoquel in a big dog, it's probably about the same price. So it's kind of nice You come in and get a shot. But like I said, number one thing you want to do on the first visit, make sure you do a skin scrape. Make sure you don't have mange, which I doubt you would have. You know, make sure you're on a good flea and tick preventative. Brevecto, which is the 3-month chewable I talked about, works on fleas and ticks. Here's the other thing we know it works on, mange. Even 1 every 3 months. I mean, when we used to get Demodex mange, you had a nightmare. Remember, I don't know if anybody had a dog mange in the old days. It's a disaster. Now with Brevecto, you give them 1 pill every 3 months. It's unbelievable. So I would think about Apoquel or Cytopoint for your dog. You have to get it through a vet.
What about mites? Skin mites.
Yeah, so Demodex and Sarcoptic mites, those are the big mites that we see in dogs. We just don't see them much anymore. Demodex is usually a disease of younger dogs where they get, you know, pretty nasty skin lesions sometimes on the feet. Especially in the like bulldog breeds, those are the ones that mainly get it. And then you have Sarcoptic mange, which are the real itchy ones that are mainly on the ear tips and the elbows. If you give Brevecto, I talked about Brevecto, the 1-month chew for fleas and ticks. If you're on that, you're not going to get mites. It kills them. That's another thing I like about it. Good question. What else you guys got?
Well, you mentioned the Brevecto. Yeah. There's some other oral.
Yes, there are. There's NexGard, which is a monthly kind of same drug class of the Brevecto. I like that. Works great. There's a whole bunch of them right now.
Is that more or less the same, or okay?
Same drug class. Okay. I like them a lot.
Yeah. What's your favorite long term, and is it 1 month or 3 month for felines?
In feline, it's Brevecto again. So Brevecto came out with a topical in the cat.
Between the shoulder blades? Between
the shoulder blades, it's 3 months. Because in the cat, a real nightmare, because the products we had before were pretty toxic and they didn't work very well. Like Frontline in the cat, Vectra in the cat. You can't use the dog Vectra in the cat or you wipe them out. Yeah. They have a cat Vectra, which is a different drug. It didn't work very well. So I like Brevecto. So it's the same drug as the one we're talking about, but topical. Because cats aren't going to take a chew.
So the Vectra is not actually the trade name for the drug, because you're going to have Vectra that kills the cat.
That's right.
And Vectra that works on the cat.
Exactly right.
So it's not the same
Vectra
chemicals.
for cats are just for fleas, not ticks. So go Brevecto.
And mites.
And they have topical in the dog, which I think is stupid. I don't know, you know, some dogs will just not eat a chew. I don't really know of any, but there are some. And you can use the topical in the dog too. But in the cat, it's strictly a topical product. 3 months though, fleas and ticks. Really, gets rid of ear mites, gets rid of, I mean, a lot of stuff.
And if the cat's in the house all the time, never outside, I still
probably would, because the thing that where people make a mistake, they have a dog, and I ask people, you know, they just can't get rid of fleas. Like, what's going on? Do you have any cats? Oh yeah, we don't do anything for the cats, they're not itching. The cat flea is the most common flea in the dog. They love to get on dogs. So, I mean, you got to treat everybody. If you're not having a problem though, and your cat's inside all the time, I'm not as worried. But you know, we see ticks in cats all the time too. Any other questions? Yeah, no, go ahead.
We've got a Bernese mountain dog, and she's always flapping her head rapidly, and I'll hear her ears flapping. And it dawned on me after a while, I thought, I wonder if she's trying to itch her ears. So our vet, how long can the dog be on mometazone? Because the mometazone seems to take care of it, but as soon as she comes off the mometazone, it's back to rapid. So is that how she's itching her ears?
Ear problems are, you know, you and I, our ear canals are very short. Like, you can take a Q-tip and touch your eardrum. In the dog, it goes down like this and then in. I mean, they're only made for veterinarians. I mean, it's a horrible design. I mean, they're like this, then they go up. I mean, so all the yuck just. So when I have dogs shaking their head, especially when you're telling me the Momentum-X works but we're off of it, I want to do a deep ear exam, because I'm going to bet you got a foreign body in the ear. It might be a plant on, it could be hair. Like, to me, that's a sign of, like, you got a rock in your shoe, and I can give you a pain reliever so you'll walk on you still got a rock in there. So that's a dog that I want to look down in the ears deep, even if I'd have to sedate them and flush it out to make sure there's not something deep. On ears, though, I am glad you said that, because there's another ear product that came out about a year ago that I really like too. Because when I tell people to clean the ears or put the Momentum-X or the ear stuff in, nobody does it right.
Yeah.
I don't blame them, because I mean, you got to go really.
Me.
No, everybody just goes, oh, I think it's a. There's a new one called Ocernia. It's amazing the new stuff they have. It's called Ocernia. It's a gel. So what we do is we look in the ear to make sure there's nothing down in there. And if they have like a yeast infection, which is really common, especially in our hunting breeds, we put this stuff called Ocernia. It has a little rubber nozzle and it's a little tube. I put one tube in each ear, just squirt it in there, and then I give you one. You put one in there in a week, and here's what'll blow you away. You don't clean for 45 days. You don't clean. We don't want you to clean. That's good. I mean, that's completely changed. I rarely use Momentum X anymore for that reason, because people are like, no, I don't even know where I'm putting it. So your dog, I would tell you, I do a deep ear exam, and then I'd probably go to Ocernia.
So when she's doing her head back and forth to get her ears to, that's how she's itching?
And what happens is in a lot of dogs, if they shake their head bad enough, and you've seen this before, they get an oral hematoma. They get a blood clot because they've broken the blood vessel in their ear. It looks like a little pillow. Now we got to do surgery. Yeah, that's really not fun. Eventually what will happen to your dog is your dog's going to keep doing that, and those ears smacking it, and they just break a blood vessel, and it looks like a little pillow. You guys know what I mean? You guys are all shaking your head. And we can do a surgery to fix it, but it's a symptom of something wrong with the ears. And with the ears, either a foreign body, like there's hair, you name it, we've seen it down there, or a chronic infection, or allergies.
So you got to have an otoscope to see this, right? So your vet.
Because you really want to go down and look down deep. I've had so many dogs that, with a history like that, where you sedate them with a little Domitar, look down there, and then flush it out.
Ocernia. Can you spell it?
Yeah, O-S-U-R-N-I-A.
Okay, got it. Okay, good.
But I would want to make sure you don't have a rock in the shoe, right? Because when I have things that are repeating like that, like an allergy, you want to get to the underlying cause instead of just keep treating the symptom.
One tube each ear, week apart.
Week apart.
Don't clean for 45 days.
It's unbelievable. Completely changed what we were doing. Just like the Cytopoint injection I was telling you about. Because here's what you learn over years of being a vet, and you guys would do it because you're dedicated owners, but the average pet owner, they're going to do this stuff for like a couple days and then they're not going to do it anymore. I'm a pet owner, we got a lot of stuff to do. So if you can do something long term, that people aren't going to have to do, I mean, it really has changed what we're doing at vet. Yes, sir.
Okay, well, is there anything I can do to lessen the bleeding when my dog rips his ear in the woods?
Oh God, that's a great question. No, there is.
I get it stopped.
It's
get
a pain.
Back in the car.
It's a nightmare.
And I got everything.
You know what I do? That's one of those ones where I'd use the sugar again. I'd have some sugar. I use styptic powder, or sometimes I'll use the like what we use on the nails, the silver nitrate. That hurts like a mofo though.
Really?
Oh, the silver nitrate. But there's nothing great to do.
Huh?
They have some clotting stuff that's kind of nice, but I would just use the styptic powder. That's what I would keep.
Okay.
But they're a pain. They're a pain. It's like saying, the skunk off products work on skunks. Okay, kind of. Not really.
Next time they get wet, they smell like.
That's exactly right. So.
And you said silver nitrate hurts like hell.
Oh, it really hurts.
But
I cut myself shaving once. I'm like, well, this works. We use this all the time on nails. The dogs don't like it, so I was like, oh, God, you have no idea how much. Like, I can't believe the dogs are as good as they are. It really hurts. The powder doesn't hurt as much, but silver nitrate is terrible. Ear stuff's just they bleed. Foot pads, you guys know. You know the whole foot pads are the whole other little nightmare. All right, well, thanks. If anybody has any questions, I'll hang out here.
Thanks a lot.
I'll put Buck's products back here.